Did you ever wonder why OLDCARTS gets pushed in our faces in every medical education class? Brace yourself, because today we're boarding the OLDCARTS train to understand why it's as critical as a stethoscope to our practice. Let's begin by putting the spotlight on the acronym itself: onset, location, duration, characteristics, aggravating factors, relieving factors, timing, and severity. While it may seem like we're initiating an FBI interrogation, rather than a patient assessment, these simple, yet profound queries form the blueprint for our clinical judgment. Really, in essence, OLDCARTS is our Sherlock Holmes of symptom assessment. It allows us to piece together the scattered puzzle of our patient's health status. Imagine your patient as a captivating novel. It's like our literary analysis lens, allowing us to uncover layers of meaning behind each symptom and sign. This is where our trusty OLDCARTS tool comes into play. It's like our literary analysis lens, allowing us to uncover layers of meaning behind each symptom and sign. But let's take a step back and focus on each of these elements, shall we? When we ask about the onset of a symptom, we're digging for the origin, the genesis of their story. Imagine a single word changing your list of differential diagnosis, which happens quite often, by the way. Consider this. You're a detective with your notepad in hand, and OLDCARTS is your strategy. We use this detective analogy in our differential diagnosis video. If you have not seen it, no worries. We will put a link to the top right of the video for you. Location, on the other hand, helps us map out the landscape of their discomfort, while duration gives us a timeline, a narrative arc, if you will. As we are talking about location, ask the patient: is it deep or shallow? Is it upper abdomen or lower? Just by knowing our anatomy, we can quickly deduce what the culprit most likely is. You might be concerned more about the right upper quadrant of the abdomen than, say, the left lower aspect, right guys? Characteristics allow us to color in the details of their experiences, the features that make it unique to them. This is the razzle-dazzle, I call it, guys. I start to get the patient engaged at this point, but still give them enough time to answer. You better have your laptop in the room, as this is where the information flows. Is it a deep, visceral pain? Is it an electric and sharp pain? Has this constipation been just a few days and their chest pain is from the gas? Or do they have a chronic history of IBS-C and haven't had a bowel movement in 10 days, all because they haven't taken their Linzess in weeks? Aggravating factors and relieving factors? There are plot twists. They introduce the challenges and the respite in their health journey. The timing sheds light on the rhythm of their symptoms, while severity? It helps us understand whether this is chronic back pain that has been ongoing, or this is a new, severe pain recently. It also sets the tone for the urgency and intensity of their story. Imagine a single word changing your list of differential diagnosis, which happens quite often, by the way. Let's say, for instance, that the location of the pain now has you thinking of a cardiac etiology, instead of a simple musculoskeletal origin or costochondritis. Or this pain is the worst headache of their life, 10 out of 10, and characterized as a sharp thunderclap. Yeah, that is highly suspicious for a brain bleed, not just in an exacerbation of their migraine now, friends. So you have changed your plan to order a CTA of the brain, stat, and getting ready to potentially admit. But it really gives you the right questions to ask to gather valuable insights, like the why, what, when, where, and how of a symptom. As NPs, these are golden nuggets of information that help us build a reliable diagnosis and treatment plan. Now, I know what you're thinking. Oh great, another lecture on OLDCARTS. But here's the twist. We're not just looking at OLDCARTS as a mnemonic we memorize and regurgitate robotically. Nope, we're elevating it to an art form. Yes, you read it right, an art form. Why art? Because just as an artist adds soul to their masterpiece, a nurse practitioner injects compassion, empathy, and warmth into an OLDCARTS assessment. It's not just a robotic series of questions. It's a conversation, a gentle probe into the patient's life, where they feel heard, valued, and cared for. Think about it. Isn't it more comforting to know you're not just asking where does it hurt? But more so, tell me about what you're experiencing. It's the subtle art of making patients feel acknowledged, and that's where the real magic happens. You are working on gaining the trust of the patient by being empathetic, as well as acknowledging their feelings and not being dismissive. This is all an art of a tactic called motivational interviewing, and if done correctly, you will calm a supremely anxious patient and get the data you need to make an accurate diagnosis. It's also important to remember that patients aren't textbooks. Each symptom they experience has a unique flavor. Whereas like wine, we all know certain conditions have smells. Like we never forget our first C. diff infection or GI bleed, right? Or some of us more adventurous NPs, tasting lactulose to see what they hype is? Long story short, it is pretty gross patients are not being overly dramatic. As NPs, we serve as sommeliers, identifying these different notes using our OLDCARTS assessment, bringing clarity to the complex symphony of symptoms. Yes, OLDCARTS has a touch of old school, and yes, it's everywhere in medical education. But just like the trusty old you can't let go of, OLDCARTS has a timeless relevance. It's not just about the information it yields, but the human connection it builds. So, the next time you grumble about OLDCARTS being shoved down your throat again, remember, it's not just an essential skill. It's a conversation starter, a trust builder, a detective strategy, a fine art, a symphony conductor, and most importantly, it's a testament to the empathy we embody as nurse practitioners. OLDCARTS is our superhero tool, and we, the NPs, are the superheroes who wield it. Buckle up, put on your superhero cape, and let's continue to embrace the magic of OLDCARTS. It's a conversation starter, a trust builder, a detective strategy, a fine art, a symphony conductor. It's not just an essential skill. It's a conversation starter, a trust builder, a detective strategy, a wine tasting, a fine art, a symphony conductor. Most importantly, it's a testament to the heart of nursing, empathy and patient-centered care. And who knows, with enough practice and finesse, you might just find that you, too, can become the Picasso or the Beethoven of OLDCARTS. As always, it has been a pleasure getting you excited about usually boring things in medicine. And we have changed the way you look at OLDCARTS. If you found this video helpful, do me a huge favor and click the like button. Also, subscribe and hit the notification bell if this has been helpful. Leave a comment below on anything you find helpful as an NP. Until next time, see you amazing clinicians in the next video.